Recorded. Here we go. Hey, mamas. I hope everybody's having a great day. If you have not met me before, my name is Jenny Gablesberg, and I am a pelvic health physical therapist. And I specialize in helping pregnant mamas and new mamas kind of navigate how to get through pregnancy and birth and postpartum as well as they can. So today, I really want to talk about the 6-week postpartum checkup and what your experiences have been with that. So if you are on live with me or on later watching the replay, I would love to have you let me know if you are currently pregnant or if you are newly postpartum or if you are past your 6-week visit and was it what you expected. So when we go in after having our babies, we, for one, are excited to show our birthing professionals, whether it's our OBs or our midwives, that we have this gorgeous newborn, that they were such an impactful part of our lives to help with delivery. So we have this short 15-minute window to have someone check all the changes that happened in these 10 months that we grew a human and having to birth a human. And we spend the first 4 or 5 minutes of this 15-minute appointment oogling over this gorgeous child that has just come in. And then our birthing professionals have things that they absolutely have to check. They need to assess to see if there are any signs of postpartum depression or postpartum anxiety that may need to be addressed with a referral to a mental health specialist. Although often we're seeing symptoms like that happening at 2 weeks or 3 weeks postpartum. So it irks me a little bit that people end up having to wait till their 6-week visit, sometimes to get screened or have these concerns addressed. So they look at our mental health. They ask you if you're having any breastfeeding concerns, if you have chosen to breastfeed. They are asking about whether you're still having a lot of bleeding, what they call lochia, after birth, which by 6 weeks is usually pretty resolved. So a bit of a red flag if you're still having heavy bleeding at that point. And they're pushing around on your belly and deciding how is that uterus doing after baby? Because we know the uterus gets quite large, right? To be able to house baby and all the amniotic fluid and the umbilical cord. Well, it has to shrink back down to like the size of a walnut. So it takes at least 6 weeks, for some people 12 weeks, for that involution to happen of the uterus. So the uterus had gotten really low in the pelvis when you went to deliver. And so it should have risen back up and really shouldn't be palpable to our physicians when they're checking us. So those are the big things that have to be shoved into that 15-minute appointment. And what we're seeing not happen, that I really would love to see happening, is checking the pelvic floor muscles if you had a vaginal birth. Being able to feel those different muscles, see if there were any tears, how those are doing. So if we think about kind of looking at those muscles that had to elongate quite a bit to be able to let baby out, sometimes we would have had some tears in these superficial muscles. We may have had an episiotomy coming into this area. So it would be really lovely if somebody was examining those muscles on internal and external, pushing on them, making sure there's not any tenderness left in here. And then if you did have a episiotomy or a tear, actually putting your finger on that and shifting it, moving it, making sure it really stretches well. Because we know the collagen type when we heal back is a little different than what you had before. We know that the tensile strength of that scar tissue only ever gets to 80% of what you used to have there. So we want to make sure that that tissue moves beautifully so you can get things in and get things out without having pain. And typically, an internal exam looking at this isn't necessarily happening during that quick 15-minute 6-week checkup. Other things to also be assessing that I would love to see all new mamas assessed for is, do you have any sign of a pelvic organ prolapse? So that means when one of the organs that were sitting up higher in the pelvis, so your bladder, your bowel, and your uterus, have any of those descended down, either from just the prolonged low-grade stretch of pregnancy, or you pushed 3 hours and your fascia or connective tissue got a little overstretched, and those organs are sitting a little bit lower than they normally would. All of those things are things that can be addressed with intentional, focused recovery. But if we don't know that these things exist, we can't necessarily treat them. And then one of the other big ones that I really would love all moms tested for is a diastasis. So we know that coming up from the pelvis, you have those long, what we call 6-pack muscles, the rectus abdominis. And those muscles, as our bellies get bigger and bigger and bigger during pregnancy, they widen to allow more room for the uterus to grow and baby to grow. So what we hope is that once baby is delivered, we do have somewhat of resolution of that. Now, talking about diastasis resolution is a whole nother chat that we could spend a whole lot of time on. But what we really want to see is that you have good control over that area. Next week, I'll be talking about kind of looking at what does that really mean, being able to manage all the pressures that come into your belly. But those are the types of things that I really would love to see incorporated in the 6-week checkup. Now, in May of 2018, ACOG, which is the American College of Obstetricians and Gynecologists, produced this white paper recommending to their colleagues that mom's postpartum visit actually should be at 3 weeks postpartum, and that postpartum care should be a continuum of care until 12 weeks. So if anybody here got checked at 3 weeks, I would love to know it, because it's not happening. At least it's not happening commonly here in Southern California. And part of it is totally insurance fault, that our birthing professionals get paid a set bundle fee for your prenatal care, your birth, and your postpartum care up till 6 weeks. So if they add a visit at 3 weeks and at 6 weeks and at 9 weeks and at 12 weeks, they just increase their workload by a ridiculous amount. And you guys all know how busy your OBGYN's waiting rooms are, just filled with pregnant mamas. They don't have time to be doing these extra postpartum visits, even though their own association has recommended that that really is best practice of postpartum care. We need to be checking things like mental health earlier than 6 weeks. We really need some way to check these musculoskeletal things that I had mentioned, and that just doesn't live anywhere in our postpartum care right now. So if you've ever had a knee surgery or a back surgery or a shoulder surgery or any type of surgery, I want you to leave me a little note in the comments and let me know, what did you have surgery on, and did they send you for therapy? Did they give you some sort of guided rehabilitation to help you get better? So say it's somebody's knee and they have a ACL repair or ligament repair. You are going to have weakness, changes in your range of motion, changes in the way you walk. If those don't get improved, then you start seeing things happen up the chain. You might start to get some hip pain or some back pain. So anyone who has had some sort of orthopedic surgery, because orthopedic surgeons are used to the last century working with physical therapists and sending their patients automatically, everyone goes 3 times a week for 12 weeks to rehab. So you were able to fix those things like your strength deficits, any scar tissue, any range of motion changes, any walking changes, so you don't end up with persistent problems way down the line. But yet, they expect women to have all the musculoskeletal changes that happen during pregnancy. So our muscles elongate, our base of support, which is kind of where we sit our feet, widens. We externally rotate those legs. We shift our hips forward to counterbalance all that extra weight that we're trying to keep from, pulling us completely over onto our faces. And then we birth that human, whether it is vaginal route, and we have some pretty significant pelvic floor changes, or the abdominal route, and then we have a lot of abdominal and fascial changes. And yet, very few people are automatically being provided some sort of postpartum guidance. Where should you start? What exercises should you be doing immediately after birth? How do you progress those exercises? So don't just tell me to do 100 Kegels. That is not necessarily what the problem is and what we need to be treating. So give me a minute. I took notes because there were so many things that I wanted to make sure that I touched on. But some of the other reasons why we are kind of not getting that postpartum recovery is our OBGYNs and our midwives aren't necessarily trained to do musculoskeletal examinations and find some of those things that may be persisting postpartum that we really need to address. So we don't have women struggling with things like urine leakage or prolapse or diastasis for the next 4 decades. And that's what we see. We really want any type of postpartum challenge addressed immediately, right after birth. What are the things that we can be doing? So moms really want immediate support. And we have to figure out a better way to be able to provide those things. So 17 years ago, I had my first child. Birthday last week, kind of crazy. And being a pelvic PT, I really thought, oh, that's not going to happen to me. I've been treating new moms for all these pelvic health challenges I've mentioned for years, and yet still didn't think it was going to happen to me. And then she was a brow delivery, which means she came out forehead first, which is the, biggest bloody circumference of a baby's head. And I ended up with a 4th degree tear. And I knew what I needed to do because I had a history of being in this field. I remember my OB stitching me up and I said, what degree was the tear? And she said it was 4th degree. And I thought, oh crap, I'm going to be my own patient. A 4th degree tear is the worst kind you can get. And so I started my pelvic floor exercises and my deep core, just really gentle exercises within 24 hours of that baby. And because of that, I was able to prevent further things happening like some incontinence or prolapse concerns after that birth because I knew what to do. I knew what to expect. I knew that there was that possibility of something happening after, although still didn't think it would happen to me. I exercised through my pregnancy. I was an athlete prior. I truly, very naive, thought it wasn't going to happen to me. But the truth is, we have hundreds and thousands and probably hundreds of thousands of moms who are struggling with postpartum issues. So we really want that postpartum care, that 6-week visit, to be a little different, be a little more thorough. And if our OBs do not necessarily have the time or the training to be able to provide that sort of assessment, then being able to share some guidance on places that moms can get that guidance that they are looking for. So we know there are hundreds of books on what to expect when you're expecting and what is the best way to breastfeed, and are you wanting to have very structured feeding, or are you more attachment parenting? We have books on how to start to feed your toddlers solids, not toddlers, 6-month-olds solids. There's so much instruction on pregnancy and raising a human, but there is not enough guidance on how do we take care of ourselves. So that is what I really would like to see improved in our world. I would love to hear what your postpartum experience was, if you felt really supported postpartum, if you went to that 6-week visit and they said, great, you're good to go. Go back to exercise, go back to sex. You are all set. Rejoin the world. And for some people, that's great. And that's all they need. And they kind of bounce back and jump right into life. But for most of us, we really would like to see that 6-week checkup, or at least that 4th trimester care, guidance, support really be buffered up quite a bit. So let me know in the comments if you agree with me, and I look forward to talking to you next week.